Hi, everyone. Welcome. Very excited to have you all join us for our LRG conversations with our Global GIST mentors today. I'm Diana Nieves. I'm Senior Director of Outreach and Engagement at the LRG, and I am so over the moon to be here with Piga Fernandez, who is joining us from Chile, and Hazel Mcleod from Canada. And we are also going to see a pre-recorded video of Amelia Yo from Singapore. Very, very excited. Just to let everyone know, after each person speaks towards the end, there will be a Q&A session. So make sure you click on the icon below for Q&A or the chat icon to type in your question, and we will be happy to answer those towards the end, the last 10 to 15 minutes of the program. But before I jump into officially introducing each person and having them share their journeys, I wanted to explain a little bit about the GIST Mentor program. The mission of LRG's GIST Mentor program is to support people with GIST and their loved ones navigate diagnosis, treatment, and recovery. And the program really exists to help patients and their caregivers advocate for themselves and also to provide emotional support along their journeys. Now, there are qualifications to become a GIST mentor. First, the GIST mentor needs to be a member of the LRG. They need to be part of our patient registry. They are volunteers. They are also along their GIST journeys for about a year or more. And they have lots of experience with regard to their journeys in terms of they are aware of their mutation type, they have seen a GIST specialist, they've completing their scans, etc. They have also completed a GIST 101 training, so they are knowledgeable of GIST, and I put in quotation marks, but they are not medical professionals, and we'd like to reinforce that. They have gone through other trainings with the LRG. They are extremely empathic, they're understanding, and they have great communication skills. They've done role playing with us, and they continue to do training with the LRG as they move along the program itself. And they're just really wonderful beings and wonderful people. It's just really great and an honor for me to know each person. In terms of becoming part of the program, a person would just fill out an application to become an LRG member and request to work with an LRG GIST mentor. There are no other requirements except for that, the desire to work with a mentor themselves. And based on what your preferences are, if you're interested in working with a mentor, if you have a specific mutation and want to work with someone with that mutation, or prefer to work with someone who's female versus male, or within a particular geographic region, especially globally, we like to connect mentees to the mentors that's within their specific country. We would make that assignments and look at that closely. In terms of how long you're assigned to a mentor, it can be 6 months to a year, depending on what's happening and the conversation that you would have with a mentor at that time. If you decided to continue with a mentor, that would of course happen. If you decided to move along, that's always okay too. And if after a year or so you want to work with a mentor again, we'd be happy to connect you with a mentor at that time. So without further ado, I get to pass the baton on to Piga Fernandez from Chile. Thank you so much for joining us. It is such a pleasure to have you here and share share with us your journey and your perspective of being a GIST mentor.
Thank you, Diana, and thank you everyone for being here. It's really a pleasure spending this hours or this time with you, especially now that because of COVID, we're so in communication. I think we never expected that this would happen, that we are more connected than ever. We have the tools to be more connected than ever with, and we can be here, people from all around the world, and just talking and spending some time together. And I would like to, my experience of the mentor program, I think it's a really great program, especially looking at it from my perspective, from a patient. I was diagnosed a long time ago when very few people knew about what a GIST was, what a GIST is. And I felt that at the beginning that it was really hard to have a cancer diagnosis, but even more having this rare type of cancer that no one knew much about it. So, and that I, through my journey, I went through several stages. At the beginning, I just didn't want to know nothing about it. I had gone through such a hard time before being before being correctly diagnosed, that I just didn't want to know anything about it. I just wanted to take my pill and that's it, and keep on with my life. But little by little things start changing. That curiosity started on my mind and started Googling what is this about. And then I found the Life Wrap group. And it was really great knowing that there was someone else who had this. There were people who knew really what this was about. People who could answer my questions. That was really great. And before that, I started being a volunteer with the library for a long time, helping them with translations and with Latin American patients. And gradually, I kept more involved, and now I am part of the LRG staff as a global relations coordinator. And in this new role, also, I saw the importance of this mentor program, because we were reaching people all around the world, and not all around the world, they don't have in their countries, many of them, much information or much support, or how to find that support if there it is. So I think that that's another huge value, that when you open this program globally, because we could offer the patient all around the world the possibility of talking to someone who's in the same journey. And on the other hand, I created here in Chile a foundation to support GIST patients. And at the beginning, we did several meetings once a month or every 2 months, and we always brought a speaker to speak them something, the physician or a nurse or a nutritionist. But we found out that although they were really interested in the knowledge that we were giving to them, they really enjoyed those minutes of the coffee break or even after the meeting. And they stayed talking among themselves when we could meet, of course. They stayed for a long time talking among themselves and sharing their experience. And sometimes it was really hard to bring them back to the room to continue with our program. So really found that was a need of talking to someone who in the same language. That's the truth, because all of us, or many of them, have the support of their family, but it's different. It's different what you share with your family, what you can share with someone who's in your shoes, who's feeling the same things that you have gone through, the same fears, the same anger, the same, that maybe sometimes you don't share those things with your family, so that you don't upset them, or because you're worried that you won't be understood. So I think that there's a really huge value in the possibility of the peer-to-peer conversation. So that's why when we talked about opening this program globally, I was more than happy, and I told Diana right away, yes, please, let's do it, let's go for it. And that's us. We're where we are now. That's what I can tell you from my experience. I don't know if it's something else that maybe Diana you want me to add, or afterwards we wait.
Yeah, we'll come back, because there are questions.
Okay.
Thank you for that introduction of you and where we are to date.
Thank
Um,
you.
Thank you. And I'm excited, just as excited to introduce Hazel Mcleod from Canada. Welcome, welcome.
Thanks, Diana. This is being a mentor, officially being a mentor is a little bit new to me. But it really resonated with me when Pika said, the stages you go through, and not everybody goes through all of those stages of, I want to know everything, I don't want to know anything. Some is to do with your own personalities. For me, the very beginning of my journey, when I was told the word gist, I went home from that surgeon's appointment and I just started Googling because I was like, I want to know all about this. I want to know what the information is. What is this? What happens next? What's the outcome? It was just like an avalanche of information that I wanted to be able to assimilate, which you can't. And it's very overwhelming usually in the beginning if you're wanting to know, because you're trying to, it's like pulling at all these threads and, all these pictures are coming at you and things are changing as you get new information from your medical team. And so in the beginning years for me, I was diagnosed correctly right from the very beginning. I had very experienced medical personnel. The surgeon was the top in his field. The oncologist was one of the top in Canada because of my location, that I had access to and had care under. And then I started hearing about people actually met in person. And that was very, very exciting to me. And when I heard about LifeRaft Canada, and I think it was close to one of their first, early meetings, and maybe the first year or so that they were together. And as Pika said, it was just, I'm a mom, and so you want to tell your kids, but they're not, that parent to, even though they were grown-ups, young grown-ups, but grown-ups by the time I was diagnosed, you're still sort of transitioning to that, out of that, I protect them. I'm the mom. I don't, there's only so many things that I would tell them. And my husband was a great support but for me, I was gathering all this information and I just wanted to talk about stuff over and over and over and over. So connecting with someone who was, as the term Pika used, in those shoes, in your shoes, and completely understood all of those, the feelings, the frustrations, the what ifs, and to be able to share with each other and encourage each other it really changed my world for being on this just journey. And a few years ago, I joined in the leadership roles in Life Group Canada. And as my time, my first year went by, and that's when and one of the other directors had a conversation with me, and that's when I realized, what I really wanted to be involved in was helping other people on this journey, helping them to, to find correct information and to find, if you were given, the news, this is it, there's no more options, and, being able to help them to see, did they really were all the options that are available in our world today, were they really, had they been explored? Were they available where they were? And just to encourage them to ask the questions, to think about, what did they want to do, to give them hope that they weren't alone. You're not alone. You're diagnosed with a rare cancer, and there's not that many of us, but there's lots of hope, there's lots of answers, there's lots of information out there. And even when it gets to the difficult challenges in your journey, you're still not alone. There still is the rest of us who want to come alongside if you're up for that, and to talk with you and to just help you work through. And so I'm a lot of my interactions at this point is, online. There's a couple of online groups that I participate in. And then there are there's people, I live in not too far outside of the core of the city of Toronto. And so lots of people come to Toronto to get the care that's offered there. There's trials there, etc. So I know in the beginning it was exciting when Diana talked about someone geographically, like thinking, I remember the first time that I found out there was actually somebody that lived in my province that had this diagnosis of a GIST. And that was really exciting to me, because and the more I've met, the more I realized, and I don't feel alone anymore. I feel a part of a group of people who are willing to help, to give you tips. They might not work for you, but it's always good to hear what others are doing and trying. And I think that I've definitely gotten more out of helping others by what they've shared with me than what I'm sure I've given out to anyone else.
Thank you, Hazel, for sharing. I so appreciate that. And yes, it seems like that is the going consensus, right? Helping others and being in those shoes to help others. It goes a long way. So we've heard from two wonderful, amazing people, just patience. And now we're going to listen to a caregiver. This is a pre-recorded video that I did with Amelia Yao from Singapore. We did this on Monday. So I'm just going to share my screen. So good morning, Amelia. Welcome. Thank you so much for joining us today and talking about you and your experience and how you came to learn of the Life Raft group and become a GIST mentor. So welcome. Thank you.
Hi.
Hi.
From Singapore, by the way.
Yes. Yeah. And we're happy to have you. Thank you so much for doing this. So if you can tell us a little bit about yourself and your journey, that would be wonderful.
Okay, so basically, I was actually a piano teacher for 14 years. Yeah. Until one day, Andrew, my husband, suddenly had a medical emergency. Yeah, and we didn't know what it was, but he said he had excruciating pain in his stomach. And it was so bad that he called an ambulance. So after they sent him to the hospital, they did a scan and they found this huge mass on his intestine. So they didn't know what it was at that point, but but he needed an emergency operation to have it removed because it was obstructing his digestion. And that was actually the cause of the pain, you see. It was basically this mass pressing against other parts of his intestine and preventing the food from passing through. So he was operated on, I think 5 days later. And that was when the doctors told us that, it most probably was a cyst. And after and basically they arranged for all the the analysis to be done on the tumor and all that. We didn't have to tell them anything. They just automatically, they knew what to do. So we were actually, I would say, in quite good hands. And then after it came back, it was confirmed to be a cyst. And they also had the mitotic rate and the mutation type and all the other info for us. So yeah, and we were also given some other basic info, and then we immediately rushed back home and did some research on our own, and so we knew what to expect. Yeah, even though, but then I should say it still it was a huge shock to us because before all this happened, we had no idea what a cyst was. Yeah, and in the beginning, I would say both of us were quite lost and in shock. I think shock was the main feeling there because he didn't have any symptoms or anything prior. Yeah, and he was relatively young. He was 44. That was 2 years ago when this happened. So yeah, it just basically took us completely by surprise, and yeah, it was quite traumatic. Yeah. But after the feelings of shock and all that passed, we found out more, did our research, quickly joined some GIST support groups, and from there, that's how we got to know of the Life Raft group. It was through one of the patients from a GIST news group that we had joined who told us about the Life Raft group. So immediately, I registered Andrew as a patient, and yeah, that's how I came to find out about all of this. Yeah.
And did you join another support group with the Life Raft group at that time? Mm-hmm.
Yes, actually we were part of, I think, GIST Support International's news group first. Yeah, I think that's run by Marina Simcox, who is quite she's a long-time GISTer, and basically from after joining that news group, we learned so much more, and from there we came to learn of the Life Raft group.
Yeah. And how's it been in terms of the information that you've received from joining the Life Raft group? And how did you become interested in becoming a GIST mentor as a caregiver?
I think the LRG has been very useful in that there are so many resources on the website. Everything you could possibly need to know about GIST is already there. So it's just a matter of searching for it, right? If you do your own research and you Google stuff and all that, everything you could possibly need to know is there. So and also there's a forum which has been very useful. So because we get to interact with other patients and find out what their experiences are. And I think this actually has been the most important part for both of us, for Andrew as a patient and me as a caregiver, because then we know what to expect. And some things you cannot just learn from reading articles or factual stuff. Some things you want to find out from patients themselves, and that's where the the forum is really useful, connecting to other patients. Yeah, and for myself, I was very inspired by all of this and all the help that we were given, especially from other patients and other caregivers as well, because I also got some personal messages from a lot of people, telling me to be strong and basically offering all kinds of support. And I valued that a lot, especially in the beginning when I was so lost. So, I thought, why not try to give back in some way, right? So, since I was shown so much kindness and compassion by others and given so much help and support, why not also try to offer the same to others, right? If I can, yeah.
And I know you've done a lot of that, helping others in Singapore who have a similar journey. Can you talk a little bit more about that?
I am the local GIST representative for our country, and we also have a WhatsApp group for GIST patients, but that's not just for Singapore, it's for Asia. So as long as you're based in Asia, you can join. Yeah, but the group wasn't started by me, it was started by another GIST patient. And yeah, so really she is the one who should take credit for all of this. Yeah, I basically just joined the group and became active in it, that's all. Yeah, but I try as much as I can to impart whatever knowledge I have about GIST to whoever joins the group. Yeah, because I think most people, when they first join, they don't know, they haven't heard of GIST before, like me. And so I think that the reassurance and knowing more about what exactly this thing is very important to them in the beginning. So that's what I do mostly, just basically provide as much info as I can.
Yeah, that's great. And I'm sure it's extremely important for caregivers, especially. Have you met a lot of caregivers that you've been able to assist?
We actually have a few caregivers in the GIST Asia group, but so far I think those who have required the most help have been patients. Yeah, so I haven't so much received any requests from other caregivers.
Yeah. So any thoughts or advice you can give to caregivers?
I think the most important thing is that you have to care for yourself first. Yeah, this is really the most important thing. Yeah. So because if you're not in good health yourself, or if you yourself require help, then you can't give yourself fully to caring for the patient. So you must make sure that you yourself are being taken care of first and foremost. Yeah, I think this is the single most important piece of advice that should apply to every caregiver. Yeah, look after yourself first.
Excellent. Thank you so much, Amelia. Thank you for joining us today. I appreciate your time and all that you do for the community, our community. It is priceless. You are priceless. Thank you.
Wow. Amelia is modest.
Wow,
She has
yes.
done so much within her community and being very active on various chat groups and offering so much of herself and her time and advice, as both Hazel and Piga So we will open up this segment to answer any questions that anybody has at this point. But I think Piga has something to say, which
Yeah.
I love.
Yeah, I just wanted to go back to something that Hazel said, that I mean, we as mentors, I think that we received a lot more than what we give. I mean, especially in my case, when I first talk to a patient, or I see them when I can see them personally, or I see them through a Zoom or something, you can perceive that the fear, the anxiety, the fear to the unknown, I mean, fear to this diagnosis, fear to the economical situation that he would be facing, and you can feel all that anxiety. And once that you start talking to them and telling them that you've gone through the same things, and you try to answer their questions, you can really see the change on their face, how they start changing, how their faces relax. And at the end, when you just tell them, you know, I'm here for you, I mean, you make a huge change. And just seeing the effect on what that causes on the patient, it's a real gift. I mean, for me, and when they call me back and say, you know, you made my life. I mean, thank you, because you changed my perspective of what I'm going through. And I mean, if you achieve that, I think that is one of the most bigger things that you presents or gifts that you can have, knowing that you have been helped a person go through that dark stage and getting to somewhere that there's a light at the end. So I think that that's really important, and it's been a really gift for me. And another thing that I just wanted to add, that why I do it. I mean, sometimes I feel what I'm doing, I mean, I should I want more time for myself or whatever. But I think that it's really giving back, because I feel myself really fortunate. I have been for 7 years with a wrong diagnosis, had a lousy life, been really bad. And suddenly I found the Life Forever. I found that there was a drug that I could take. I found that there was a program that gave it for me for free. So, I mean, I just couldn't be more grateful. So I think that I that's what I do it. I mean, just giving me back a little of all that I have received. So that is what I wanted to add to what I was talking.
Yeah, excellent. Thank you, Piga. Hazel, did you want to add anything?
No, but I'm open to questions.
Yes. Just a reminder, if you have a question, just click on the icon on the bottom, either the chat or the Q&A, and we'd be happy to read those questions aloud and answer those questions live. We don't have any questions just yet, but I have a question. So I think I wanted to get into, challenges that might be faced within your geographic area that someone else might not experience in another country, and how, working with a mentee within your own country is beneficial.
Okay, I can go first. I mean, I think one of the biggest challenges we find here is the access to treatments, because we don't have access to all the treatments that are available out there. And when you help a patient through his journey, you help them have his mutational test, and finally, when you know which is the drug that he should be taking, and telling him, but it's not available. I mean, if you don't have a huge amount of money to get it particularly from somewhere, it's really hard. It's really hard to that point. You tell them, yes, there is something, but you can't afford to get it. So that's one of the biggest, the hardest part. And in that case, what we do, we give them all the information of the possibilities he have. And I'm very fortunate to work hand by hand with a physician and G specialist. And we try to guide them to the best, for him to get the best treatment available for him. and always trying to, with your contact with the library group or with the farmers, trying to help them to get the drug they need, which you never at the end, you never, not always can get it, but at least let the patient know that you're doing everything that is in your hands to help him. I think that is one of the, and that makes you, on the other hand, that I have been forced to get into an area which it wasn't, but not on my scope. That's all the political thing. I mean, having to be advocate, having to go to the Congress, having to meet with politicians, so that opened another area of my work here, and advocating that level, to try to get coverage for the treatment. And they know, and the patients know that, because they see me on the TV, they see me on the news, and they know that I'm really doing whatever I can to help them. So that's, and they are very grateful for it, and they understand that, well, there's not much that you can do, but you're doing all what is in your hands to help them. And that's one of my biggest challenges.
Excellent. Thank you, Higa, for answering that question. And it looks like someone typed in a question for you, Hazel. Do you know of any support groups around London, Ontario?
So my answer to that would be that Life Raft Group Canada, we have done a few, since the pandemic started, we've done a few online meetings. We have held in the Kitchener area, we have held 2 different in-person meetings, and we did that in I think we did that twice in 2019. So here in Ontario, we at this point, right at this moment, we don't have any in-person meetings planned and set, but we, I believe later this month, we're doing our online, we have to have an annual general meeting, which we usually hold in the middle of what we call our day of learning. So it's like a whole day, and we have speakers come in and share. And the last few years, we've also done, one of the sessions has basically just been where the patients and the caregivers who are attending are given a chance to talk to each other in the group, to ask who in this room's got the same mutation as me, who's, this is my story, and this is how things, this is the tip I've learned, and it's just a real sharing time. And I see that the person who has asked about the meetings in London is happy to have a Zoom meeting. We are actually having a Life Raft Canada board meeting soon. I'm sorry, my brain gets these little blips, and I think it's tonight or it's next week. I can't remember which. And I will make sure that that's on the agenda to talk about when our next virtual meetings will be held. And if you would like to be put on the list, the notification list, you can go to the Life Raft Canada website, or you can go to the Life Raft US, because they, whenever they get requests from Canadians, they typically funnel it back into those of us in Canada. And we can certainly let you know when that is, and we would love to have you join us.
Awesome. Thank you for that, Hazel. I see questions here from different folks in terms of support groups in the Midwestern region of the US, and how can I find out if they're just patients in my area, We do have a thing called Gist Chat, which is online. If you're an LRG member, please feel free to post a question there of, this is where I live, anybody in my area. We also do have state leaders within the United States that we could connect you with who organize meetings, like Hazel is talking about meetings that she's having in Canada, and Piga also has and hosts as well. We'd be happy to connect with you or connect you to those groups. And I have your names here. I won't say them publicly for confidentiality reasons, but I'd be happy to connect you with those different groups. Again, but do also remember about Gist Chat, and feel free to connect with other patients and caregivers. It's a great online community and a great resource for people to chat with one another and connect that way.
There's a question regarding COVID vaccines and
Go
GIST.
for it. Go
Yeah.
for it, Piga.
Okay, we're not medical professional. I'm not a scientist. That's first of all, I want to have that very clear. And I think that there haven't been already any studies finished regarding the relations between this. But what I've heard, and let me know, Diane, if I'm wrong, is that there are very, very, very few GIST patients who have got COVID. So maybe there is something, or with the treatments, or with the kids or exon kids. We don't know. I don't know. I'm very honest, but I have really heard from different persons and from different origins that there are very, very few patients, just patients who have had COVID. So probably there's something there that we're going to soon know about.
Yes, that's correct, Pika. That's what we have been informed of in terms of our conversations with GIST specialists and what we are aware of within the community. Again, we're not medical professionals, just sharing information that we have received from others, and happy to share that. And as we continue on, I'm sure, more information. Look to our website, the LifeRef Group website. There's a lot of information, resources, newsletters, our LRG science publication. And, as more articles are produced and shared, please feel free to go to our website to find out more information. We always try to keep up to date with what's going on.
Yeah, and any specific questions, please send it along. We can forward to the specialists and have them answer it with more data and with a more scientific view of it. So please do it.
Yes, exactly. Thank you. There's a question here. Because of the pandemic isolation, have you seen any changes in how patients/caregivers are feeling? Any of them expressing or having expressions of depression? Do either of you want to respond to this first?
I among the patients that we have been working with, I haven't had much information about depression, but here, especially in Chile, we've very increased our communications with patients. We had a WhatsApp group, and so we're constantly posting and asking how you're doing. We made several activities, yoga classes, cooking classes, a lot of things, keeping them busy and letting them know that they're not alone, and sharing the experience of being in-house as the same, and trying to give them tips of how to handle it. But I don't know globally. I haven't heard of it either globally, the people with whom I have been in contact to, but I'm sure that it has been an issue that among other communities, I know that it has been a problem.
Thank you.
I would agree. I know for myself personally, I had a reoccurrence and started back on treatment after 12 years clear, and so I started on treatment. A couple months into that treatment, I reacted badly enough to the Gleevec that I had to take a break. So I was in the middle of the break when the pandemic hit, and everybody, I was already working from home, but everybody else, all my coworkers were all sent home. And then shortly after that, within a few weeks, all of that happened to me. And then I went on sick leave. So for me, there were a lot of changes that, really in my world that really changed. And, from somebody who was working probably a minimum of 50 hours a week to go to no job, no interaction with, a lot of people. It was, there were definitely struggles. There were definitely days when it was, but for, in a bigger picture, I would agree with Piga that I'm sure it has impacted, because people can't, you can't, I haven't done an in-person appointment with my oncologist for about a year and a half. So there's just been so many changes, and so much in-person stuff that has changed for caregivers and patients that I'm sure mental health is a definite part of that picture for a lot of people now.
Yeah, and we encourage, that's why we've been encouraging even more so the Just Mentor program and support groups that we've had. While they've been virtual and online, we've received a lot of feedback of how useful all these resources have been during this time, especially. So keep in touch, reach out to us via Just Chat or email. We are here to help you in whatever way that we can. We did receive another question or comment from someone. I'm not sure if I was ever given my gene mutation or had it explained to me. So we highly encourage you, of course, to speak with your doctor, to request your pathology report if you don't have it. If you do have it, the patient registry staff at the Life Raft group can help you understand it better, or definitely, again, ask your doctor for that explanation and information. And if you haven't had a mutation testing done, please do ask for one. To get one done. And there's another question here. Do you know if GIST patients are more likely to develop autoimmune disorders? So, Pika, would you like to answer that?
I really don't know. I must be very honest. Although I can tell you that here in Chile, for example, when we were getting the COVID vaccines, in the third one, there was a special division. I mean, if you had any type of cancer or you were under any type of cancer treatment, you should choose a special type of vaccine, and they considered you with your autoimmune compromise. But that's what I can tell you, but I am not sure if GIST patients, I mean, we really develop autoimmune disorders. I don't know. Yeah, that's a good question to ask to our doctors and to our patient registry department. So we'll take note of that.
Exactly. And that was a trick question, Piga, and you answered it beautifully, like I would have expected you to. Again, reminding our audience that we are not medical professionals. The information, yes, that we have available to us through our doctors, online, through the Life Raft group, and our patient registry department is very knowledgeable in terms of research and data that is available to us.
And I
I'm
just,
sorry, Hazel, go ahead.
I just want to say that we need to remember as cancer patients, not necessarily just GIST patients, but cancer patients, or I'm sure it probably comes up in other diseases, like, you know, if you have some kind of rare disease or some kind of disease that you have a lot of monitoring going on, that, you know, somebody's checking, you know, medical people are checking your blood levels and scanning you and whatever. So there is a tendency to find, you know, for some people to have other things found. But it's simply not because you're a cancer patient or a GIST patient or a, you know, fill in the blank patient. It's because you're being monitored and they are doing all those tests. Whereas, you know, the lady who lives next door, you know, she has her yearly checkup with her doctor and that's it. She's not having blood work done twice a year or scans or so. I mean, we always want to know if there's a connection between them, but sometimes it's just because somebody's looking at us closer and they find it. They just find it. You know, if you're like say a diabetic and, you know, a part of that disease can be, you know, neuropathy. And so they're checking those things and they find you have neuropathy. Well, it's because somebody was taking care of you.
You're right.
Thank you. Thank you, Hazel. Yes, yes. So ask questions, be an advocate of your care. If you're a caregiver, obviously being an advocate for your loved one. And there is a comment here and I'll read it aloud. It's from our executive director from the Life Ref Group, Norman Scherzer. We believe that the pace that you live should not determine whether you do live. So I just wanted to share that information out loud. Are there any other comments that you, Piga or Hazel, would like to share at this time?
I just want to encourage those who've asked specifically questions about being able to connect with others, about meetings in their area. If you are unclear of any of the things that Diana has said of how to get to those connections, please make sure that you know, ask her, that you connect with someone. We really do want to see you connected.
Yes, yes. Thank you, Hazel. Anything you would like to add, Piga?
No, I just wanted to repeat something that Amelia said, that when you're being a mentor, I mean, it's very important to take care of yourself first. I mean, because it's very difficult to set a boundary. I mean, you just can't tell them sorry, this is an office, we're open from 9 to 2 and because sometimes they need you not in that frame of time. But it's important to care of yourself and let them know, your mentee, that you are a patient as then, and sometimes you won't be available immediately, but that you will be answering as soon as possible. And you have to charge your batteries. I mean, do something else that you really like, enjoy things that, because that's the way that you're going to be able to be strong enough and in good fit to help others. So that taking care of yourself, and I think it's very important for you as a mentor, especially if you're a GIST patient and you're going to be a mentor. Take sometimes for yourself to do things that you enjoy. I mean, to be whatever you like to do, because that would give you strength, and the strength you need to keep on and doing this that sometimes can be very difficult. But if you're okay, it can be okay for the others too.
Thank you, Pica. Excellent advice. Thank you both so much for being here today, and Amelia, who whom I was able to connect with. She would have been here live, but there's a tremendous time difference from Singapore to the US. But we're sending her awesome vibes from here. If anyone is interested in becoming a GIST mentor, please feel free to connect with me via my email that I've put on in the chat. It is dnieves@liferaftgroup.org. If you are interested in connecting with a GIST mentor, you want someone who is empathic and understanding and can offer an ear, and who will encourage you to advocate for yourself, feel free to contact me. I will be happy to connect you with one of the GIST mentors, and or sending us a message through the website. On our website, there is a GIST mentor program page, and it has all the information about the program, and whether you can click on buttons on whether to request a mentor or to become a mentor. I will say this again, we are so appreciative of all of our GIST mentors across the globe. We so appreciate you so much. We could not do this work without you, and enjoy your day. Thank you so much for being here, Piga and Hazel.
Thank you for the opportunity for being here and sharing what we go through our journey with others. Thank you, Diana. I really appreciate it.
Thank you.
Thank you. It was good to see people join and listen and learn. Thank you for the opportunity.
Thank you both. Take care.
Take care.